Hey everybody, welcome. We will give it a few moments to let everyone arrive. Thank you for being with us today. Welcome everyone. Okay, great. Let's go ahead and get started. So good afternoon or good morning, everybody. Welcome. My name is Laura DiMaria, and I am NACCED's Executive Director. And NACCED is the National Association for County, Community, and Economic Development based in Washington, D.C. And NACCED represents local governments and is a resource for affordable housing and community development professionals all around the country. So we're very glad that you can be with us today and extend also a special welcome to NACCED non-members and those who are joining us for the first time. And so you can learn a little more about us at our website, which is nacced.org. That's nacced.org. And follow us on Twitter and Facebook at NACCED News, NACCED News. And I definitely encourage you as we hear and listen to our presentation today, if you find anything interesting that you want to tweet at us about, please do. And so today we're continuing NACCED's summer meeting, which is called Moving Forward Together. So this program has been designed to bring together a few of the best speakers and thinkers in the community development and affordable housing space to discuss the state of things in 2020. So what we've been through, what we're continuing to go through, and how to proactively move forward in the future. So this week we've been talking eviction prevention, health and housing, economic recovery, and much more. And so today, the format of our series is that everyone on the call is in listen-only mode. There's definitely going to be time for Q&A at the end. So at any time, if you'd like to put a question in the chat box or the Q&A box, please feel free to do so. And this session will also be recorded, so you can reference it later or share with your colleagues. And so today, I'm very pleased to introduce you to today's speaker, Peggy Bailey, who is the Vice President for Housing Policy at the Center on Budget and Policy Priorities in Washington, D.C. So Peggy's talk for us today is called COVID-19 and the Intersection of Health and Housing Now and in the Future. And you can find Peggy on Twitter at Peggy Bailey DC. So at the Center on Budget and Policy Priorities, Peggy oversees the center's work to protect and expand access to affordable housing for people with low incomes. Throughout her career, she has helped build connections between the housing community and health, nutrition, child welfare, and other systems of care amid the growing recognition that access to stable, affordable housing is a necessary foundation that enables low-income people to meet other basic needs. So while at the center, she has worked to bring the lessons learned from innovative state and local programs that coordinate health and housing services for highly vulnerable populations to national partners and policymakers. She has particularly focused on programs and policies that successfully integrate housing and services for people leaving the criminal justice system, people with histories of homelessness, and people with chronic behavioral or physical health conditions. And so the center has a report. It's called the Framework for an Equitable COVID-19 Homelessness Response. And I will put a link for that in the chat that you can reference while Peggy shares her presentation with me. So without further ado, please join me in welcoming Peggy Bailey.
Hello, and thanks so much, Laura. I'm really excited to talk to everyone today and to hear your questions. I am gonna share my screen really quickly. There we go. Great. So as I said, thanks so much for inviting me to speak here today. And on this topic that's near and dear to my heart has always been the intersection of housing and healthcare. I say a lot. I worked at the National Alliance to End Homelessness 15 years ago, where I brought some public health background to the homelessness space and got to work on health and the intersection of health and housing before it was cool. And now, and we've spent this last decade or so really digging into health and housing. And now with COVID-19, we can see the why that was so important, and why we should have done better. Just to step back a little bit to explain who the Center on Budget and Policy Priorities is, in case you're not familiar with us. We're a DC-based policy think tank. We've been around since the 80s, and we started with the mission of fighting federal funding cuts that were being implemented during that time, trying to explain the role that safety net programs play in people's lives, and that cutting dollars in one place doesn't necessarily mean you're going to save money in other places, and to also bring to the conversation the harm that can be caused when the safety net isn't protected. We generally promote, we got our foundation in working in budget and tax policies for low and moderate income families, but we have teams that work on SNAP benefits and TANF and other income supports for families. We have a health team that focuses primarily on Medicaid and Medicaid coverage. And then we have a strong state team that works with 42 states and the District of Columbia on their budget and tax issues at the state and local level, again, with a focus on helping those with the lowest incomes. As a part of our housing work, we hone in on those folks who have the lowest income. So that means that we primarily work on rent and helping people pay their rent. We don't do very much on home ownership. And we do a little bit in the supply space, to the degree that we're trying to make sure that as we increase supply, it remains affordable for people with the lowest incomes, and that for people with the extremely low incomes, we're doing what we can to increase access to subsidy programs. So we work on HUD rental assistance programs. Especially in the last year, we've focused in on fair housing and protecting access to housing. So commenting on the disparate impact and affirmatively furthering fair housing regulations. We've worked a lot on helping voucher holders access neighborhoods that are maybe more expensive, maybe segregated maybe white segregated communities that voucher holders haven't traditionally had access to. Generally, we talk about these as mobility programs. We're transitioning some of that language to talk more about neighborhood choice, so that we're trying to do things so that people can access whatever neighborhood they want to choose, whatever neighborhood they want to live in, which also means that we're working on investments locally to help people have real choice. It's not just about leaving high poverty areas, but let's invest in those communities and allow people to stay, while also providing supports for people who want to move and find housing in other places. We've been doing work to protect the housing for immigrant families, and we all know that soon we expect the administration to issue regulations that could threaten homeless shelter access for transgendered and non-binary people. We've honed in on homelessness, and that's what the framework that's in the chat is focused on. We've usually worked with partners in the homelessness space, and now we're doing more to bridge that gap between the homeless services partners and the housing partners, because it's going to take all of us to solve the problem of homelessness. But and we won't stop homelessness if we don't stop people from being evicted, and working on keeping people in the housing that they're already in. I came to the center 4.5 years ago as the director of our Connecting the Dots project, which looks at housing as a social determinant of health, and works to integrate housing into healthcare spaces and health into housing policy, so that we're really working together for, as Laura said, I've had a career focused on those with the greatest housing and healthcare need: people leaving the criminal justice system, people with substance use disorders, and people with disabilities. And now we're doing more at the state and local level, because housing policy doesn't just happen at the federal level. State and local communities are getting our policies and practices are essential to carrying out a vision of better access to affordable housing for all. And in the gap with stagnant funds from the federal government, we can see that state and local housing agencies are stepping into the void, because, and all of you know that at the state and local level, you don't have the luxury of waiting for more federal funds. You've got to figure out how to make things work, because people people need affordable housing. So when we think about COVID-19 and housing and health, we also have to think about the role that racism and discrimination plays in that. So what I'm going to talk about today is the housing and health and how they're playing out in the COVID-19 spotlight, but we can't talk about those things without talking about racism and discrimination, especially since it's been so integral into our housing policy landscape for so long. And COVID shows us that this, in the public health space, we've talked about how zip code is a predictor of future outcomes as an adult, as children grow into adulthood. And this isn't by accident. In Richard Rothstein's book, The Color of Law, he explains the policies and practices that have created this fact and that have allowed for segregation of Black and brown people into communities that have then been neglected or underfunded by policymakers. And what COVID has shown us is these outcomes that we talk about that usually we look at over someone's lifetime or a family's lifetime. Now we're seeing the results of that in a matter of weeks or months. And it's bringing into stark reality what's been happening, what we've always known has been happening. So let's dig into that a little bit. Why is housing and COVID so overlaid? It's because so many elements of housing impact people's health, and it's those same impacts that are the high risk factors for COVID-19. So housing, it determines how close you live to your doctor or hospital. So if you don't live very close to a primary care doctor that you trust, you're not going to go there. And that means that you're not going to have access to the preventative care services that so many of us rely on and that are predictors of better health. You may live someplace with significant environmental hazards, and that could cause you to have asthma. And asthmatics are extraordinarily high risk for COVID-19. You may not live near a grocery store or have access to healthy food. And we know that diabetics are also at high risk of COVID-19. You may not have access to shelter. You may be experiencing homelessness, but housing quality is also a key piece of the puzzle and could cause high exposure to the virus. And living in congregate settings it means that it's hard to practice social distancing. And one thing that we don't talk enough about is mental health. And if you're constantly stressed, we know that stress harms people's immune systems. So if you're worried about your job, if you're always struggling to afford a place to live, you're under an enormous amount of constant stress that can harm your immune system and therefore make you vulnerable to the worst outcomes of COVID-19. So let's look a little bit at what this means from the perspective of race and and the health disparities we're seeing. And it's important. One thing I want to make sure that folks understand is that when we're talking about these health outcomes, we can't just say people of color, because each race and ethnicity group feels the harm of COVID differently. And it's also varying by location. So I'm going to share with you national data, but this may be different depending upon where you're located. One of the key pieces, and something that I think I want to make sure if you leave this hour that we have together with nothing else, it's that data is so important. And then when it comes to contracting COVID-19, it's hard for us to know by race what's happening because not every state requires communities to report the data. So we know anecdotally that people that Black people, Latinx people, and Indigenous people are contracting the virus at higher rates. But I didn't feel comfortable sharing national data because it's just not reliable. But you could also go to the Kaiser Family Foundation website. They have a COVID page that's tracking these things by state, and it also will tell you if your state tracks COVID incidents by race. For hospitalizations, though, we do have better data, and we can see that American Indian and Native Alaskan people are 5 to 7 times more likely to be hospitalized due to with COVID-19. Black people are 4.7 times more likely, and Latinx people are 4.6 times more likely. And the death rates are also significant. The Black people are dying at 3.8 times the rate of whites. American Indian and Native Alaskan people are at about 3.2 times, and Latinx people are 2.5 times. And so it is extraordinarily important that we dive into why that we dive into why this is happening, because when you see those stats, it's important to we have to acknowledge that it's not inherent to me being Black or someone being Latinx to be sick, right? There's something that's causing these groups to see, I almost did it, people of color, these groups to have disparate outcomes. And so much of it is tied to housing and the racism and discrimination that happens in housing. So as I said before, that segregating people, you know, we're having to evolve how we're talking about this, because for so long we've talked about segregating Black and brown people as bad. But it's also not inherently bad for Black and brown people to live next to each other. It's what happens when we are segregated. And it's that policymakers then make specific choices about where to invest dollars and where not to, and what policies where to move the highway to, where is the garbage dump going to be. Those choices are made, and too often the choices that can harm people are made in communities of color. So as I mentioned before, the color of law really lines out these things. And I think it's important to look at these things because specific decisions cause these disparities and show us this integration of health and housing, it means that we can take specific actions to reverse it. And that's really empowering. This isn't something that it doesn't have to be this way. Let's just pull out, for example, the disinvestment in public housing, right? We should start to think about what can we do to preserve public housing and break up the harmful effects of people in public housing. I think one of the things that I was at a conference a few months ago when we could still go to conferences, and was asked what it gets at me out of bed every day. And the thing that I mentioned was in the public housing space, that I want to be able to go on a site visit tour of a city and not be driven directly to the public housing section of town where there are people with air conditioners that don't work and buildings that are falling down and no grocery store in sight. I want to be able to drive around every city in the United States and not be able to tell where the public housing is, and not, because that, especially for me as a Black woman driving through those neighborhoods and it constantly being people of color that are suffering in housing that we're supposed to be taking care of is just not acceptable, and what I want to make sure we're able to fix. So let's think about what are the things that we need to do to reverse these disparate outcomes that we can do today with the resources that will be coming down the pike. Um, uh, because as I said too, if we do the same old thing with the resources that we've got, we're going to get the same old results, and that can't be acceptable. I think the first thing is data and understanding the data, especially in your communities, being able to tease out by neighborhood where is COVID happening, who lives there, and what are the circumstances of the people that are contracting COVID is vitally important, because then you can target resources to them. So many of the resources that have been included in federal funding so far are pretty flexible, or you can at least ask and you can ask for additional flexibility. So the more that you know about what's happening at the local level, the better you can the better you can use that flexibility that was provided. And tailoring the response in that way also means we can't be afraid of implementing an anti-racist response. And what I mean by that is we can't be afraid to invest in communities of color because we're worried about how it looks. It's communities of color that are being harmed, and so we have to tailor our response to meet that need. And there are obviously other communities that are being harmed too. If we're thinking about people, essential employees who have to go to work, whether the state shuts down or not, are they living in the same, in places that you can identify? Are there ways to target resources to that community? Working across housing and public health with public health partners, those are all things that are vitally needed. So one of the things that we did at the center, and this is the link that Laura put in the chat, is not only advocating at the federal level, but it's so important to help you all implement things at the state and local level the best that we can. So we developed this framework along with our partners at the National Low-Income Housing Coalition. So if you heard from Diane yesterday, the National Alliance to End Homelessness, the Urban Institute, and a few contractor partners to develop this framework. And what it does is it tries to break down the immediate, short-term, medium-term, and long-term action steps that you all can take as you get emergency solutions grants dollars, but also giving you tools to help you understand the other resources that are coming down the pike that you can use ESG and the CDBG grant funds to leverage. You'll see that really also focuses on racial justice and equity, because we, as I keep saying, we can't fix these problems if we don't take them head on. And so there's some ways that we suggest doing that, helping develop an equity-based decision guide so that you can measure yourself, so that every decision you're making about where investments go, you're thinking about how you're resolving past inequities along the way. As I mentioned, data and mapping technology, and Urban Institute is really doing a lot of great work in this space that you should check out and tap into. One of the reasons why in this presentation I've tried to focus so much on American Indian and Native and Alaska Native households is often they're not seen in data. There are reasons why sometimes the populations are too small in one place, and so it's hard to protect privacy, but it doesn't mean that they aren't feeling the effects. And so it's important for us to dig into it to make sure folks don't remain unseen. So if you have small populations of any of these groups that we know are inequitably experiencing COVID, you see what partnerships you can create to dig into the data the best that you can. So just before we open it up to questions, I want to also talk about what we're seeing for the future. So in the short-term future, hopefully, assuming that Congress gets its act together and passes a next COVID package, we're doing a lot of work to make sure that that policymakers and members of Congress understand that what happened in previous legislation so far this year was good, but it's not enough. And that housing is complex. And so we need to fund different buckets. And I'm sure Diane talked about this yesterday, but we need to make sure that there's funding for people experiencing homelessness. We need to make sure that there's eviction prevention dollars. And we need to make sure that we invest in the housing choice voucher program, because there's a subset of people that we know from the research that if we give them short or medium term rental assistance, they're still not going to be stable. So why don't we just skip making them feel like failures every time we drop them off of programs and give them something that'll stay with them for as long as they need it? And that would be a housing choice voucher. So we're proposing additional resources in that. And we're hopeful that that we'll be able to move something like that forward, which would be fantastic. And the biggest piece is explaining to policymakers that as negotiations happen in Congress, and we know that, or we expect that, you know, the 150 or so billion dollars that the House proposed in their bill a couple of months ago probably gets whittled down, that these things aren't in competition with each other. They've got, you know, as the amount of dollars we have go down, we need all of these things, just maybe at different rates, but we're not competing with each other across the housing system. And that's a message that we're continuing to drumbeat, and next week we'll be releasing some papers that explain about the eviction moratorium fall off that Diane talked about yesterday, and explain why these bucket of funds are needed and not competing with each other. And of course, we as housing advocates need to join in partnership with our public health friends in asking for more public health resources so that are flexible enough to do as I've been talking about, and targeting resources to the neighborhoods and people that have been hardest hit. And then in the long term, we are going to be, we're going to be looking at strategies in two buckets. One is, you know, if we're in the same policy environment we're in now, what do we need to do the things that I talked about before with protecting access to housing and continuing to lift up the drumbeat of what I expect will be a continued economic recession and the housing needs of people during recessions, and how hard it is for low-income people to ride the wave of when the economy starts to turn around. Usually our folks are further behind, and it takes a lot longer for them to benefit from an economic recovery. But if we're in a policy environment where we can where we can think progressively and really tackle the affordable housing crisis, we're looking at, what does a major voucher expansion look like? What are the steps needed to get to housing assistance for all, and what are the things we need to do to current programs to shore them up so that they can support more money and more people in them, and make them obviously also easier for all of you to administer. So it feels good to be able to talk about that kind of progressive policy, and I hope that we're in an environment where we can really take advantage and make great strides, because we've been treading water for so long. So that is the end of my presentation, and I'm ready to take questions.
Thank you, Peggy. Thank you so much for all that information. And if you, as we mentioned, if you have any questions, just put them over in the chat, and I will keep an eye on that based on the presentation, or if you've had a chance to look at the framework that I also shared out. So my first question for you, Peggy, and we've been asking this of all of our guests this week. So you're not our first guest this week also to talk about things in terms of the short and medium and long term, you know, like both in terms of what are policy solutions, but then also just, you know, how do we think about the current state of things in short, medium, and long term. And so we want to also look at all of this through the lens of local government, since that's primarily who NACCED's members are. So where should local governments begin? I mean, are we still in the short term sort of trying to help people immediately, or are we ready to start thinking about long term as well?
Well, I think that you have to think about long-term as you start to implement short-term policy, right? Because we don't want to lose this moment to think about the ways that you can use the resources that are coming out of Washington, hopefully faster than they have been, to implement long-term change. One of my favorite examples is Louisiana after Hurricane Katrina. They had an immediate crisis, but they used the emergency resources that came down to them to reorient their homeless services system and reorient their their nursing homes and institutional facilities, and to in a way that they may not have known how they were going to fund it long term, but they went ahead and laid the foundation with the infusion of resources they had, with the idea that if we build it, we'll figure it out. And they have, and they've made great strides in supportive housing, in expanding supportive housing, not just for people experiencing chronic homelessness, but also for people who would otherwise be over institutionalized, with additional resources over all of these years. And I think that's the approach to take at the local level too. How can we use these dollars to not just in the same ways we always have, but to really make those change that we've all complained about, in the past?
Yeah, absolutely. And I think, we've also heard this theme this week too, that it's not just about kind of fixing what is wrong right now, in terms of how COVID-19 has exacerbated a lot of inequities, but making things better so that should another crisis occur, whether it's a natural disaster, not necessarily of the medical crisis variety, but of, hurricane, whatever, or for example, in New Orleans, I'm sure that's, Katrina related. How do we get to a point where we don't have to do this work almost like retroactively every single time, so that the systems and everything, the safeguards that are in place are there, and they're good. And I recalled something that I was thinking of in the beginning of your remarks. And again, if anyone has any questions, please place them in the chat and I'd be happy to read them out loud. But your comment about going into a city and not being able to tell what the public housing is, essentially, and I just had this moment of memory the first time I went to Chicago, which was it was before I was working in housing. I would say well before I was working in housing. So the Cabrini Green community is no longer there, but the people that I was with made a point of driving to that area and pointing it out, and it's just an empty field. It may be something different now. But then there was nothing there. And even at the time I thought, well, this is a little over the top, isn't it? I mean, do we really need to sort of revisit the misery here? I mean, what good is that? So that's definitely, it seems like it's almost like a part of our culture to look at those places and, they become something else, and we forget that there are individuals and people who live there, and who had lives, in communities there. Okay, so we've got a question. How do we effectively communicate the critical resources that are currently available to the hard to reach, low and moderate income and minority communities, especially in a virtual environment? I think a great example of that is helping people know their rights when it comes to eviction, for example.
Mm-hmm. So we worked with the National Housing Law Project actually on something like this. And because everything that comes, I mean, I don't know if you know the center at all, us writing an 8-page paper is a feat. Usually it's much longer than that. So it's definitely not translatable to real people on the ground. So what we put together was a flyer that explained, it sort of had if you sort of a step-by-step on trying to help people understand what their rights were. And we worked on that with the National Housing Law Project. I think partnering with those folks that are on the ground, community organizers who are still out in the field trying to do, doing the work that it takes. We can't rely on internet access even for the folks that we're trying to reach. So it is about, safely trying to deliver, whether it's mailing things to people, like I said, using community organizers, using the legal aid, that are going to have more regular contact with the people that we're trying to reach. I think those are some tools that that you can use. But we've also seen open town hall meetings too, because people, if people have time to figure out how, have internet access or use their data plans, manage their data plans, people have been joining online Zoom chats. And you can do those too, where people don't have to be on video, they can just call in, and then you can deliver information that way too.
Yeah. And a lot of, well, all of our members received CARES Act funding, CDBG and ESG. And we know that some of them are using those funds to help with, I guess maybe for lack of a better word, basically like housing counseling, mediation, things like that for individuals. So it's certainly within the realm of possibility for local governments who have received CARES Act funding to basically, in answer to this question, to use those resources to fund nonprofits or groups who are doing the work of outreach to these low and moderate income vulnerable populations if the local government itself is not able to do that kind of outreach.
Yeah, and I think the other thing we forget too is the role, what is to start to have more expectations from landlords, at least in a rental space, and property owners, engaging that community and trying to get them to educate their tenants. Right now, actually, and you may be hearing this locally too, there are a lot of private owners who are like, wow, we kind of wish we had voucher tenants right now, because then would be a source of income. There are the landlords and property owners want people to pay their rent. And so trying to engage them to understand what they could give to their tenants to help them actually pay their rent is a lot easier than some of the other convoluted recommendations we're having to deal with the rent crisis.
Absolutely. So another thing that has been a lot in the news and certainly within the affordable housing industry and movement is the Rent Relief Now movement. Is the center sort of a part of that? There's a hashtag if you want to look it up on Twitter, hashtag Rent Relief Now. Certainly National Low Income Housing Coalition is leading the charge on that. Does the center have a position on that movement?
Yeah, so we are a part of that movement. I've tried to use that hashtag as much as possible. I think, one of the things that one of the messages that I have at least is in thinking about an equitable ways to address rent relief. It's how do we get resources to people, and so that people can use their own agency to pay their rent, or if they need cash assistance, let's do cash assistance to help them pay for the other things that they need. There's this tension between assistance going to for-profit entities rather than to people, but we don't want to layer on some of this implicit bias that we have on people and low income people in particular, that they're not going to pay their bills or they're not going to do this. People are going to pay their rent. And so we should help them do that. And so we are a part of the Rent Relief Now. But also I think the other part is to explain that things like the eviction moratorium doesn't mean that people aren't still acquiring rental debt, that efforts to do to help to like rent control or rent forgive or rent or not rent cancellation. I don't know why I couldn't think of that word. are not, why they can be harmful too. We want people to pay, we want all of the other upstream things that don't happen if we're not collecting people's rent. And so again, talking about how it's much simpler to do rent relief and give people rental assistance than it is to do these other things that then have unforeseen consequences. I think my favorite thing that I've seen so far, in addition to the John Oliver piece that he did a few weeks ago, is the Hassan Minhaj, who did a whole episode on rent relief and showed sort of the domino effect of what happens when people don't pay their rent. And that's what we're trying to communicate. It totally makes sense why people would want rent cancellation, but it's not the best policy solution. The best policy solution is money to pay rent.
Yeah, definitely. Yeah, I think we get in a tricky place where we're pitting renters versus landlords. I mean, I don't know how that will benefit anybody. And you're right, it's a whole ecosystem. It's not just, those two individuals or two entities. And we do have another question that came in the chat. So Peggy, do you have examples of communities that faced the history of their segregation policies and took specific actions to correct the effects?
So, I can't say that there's any one place that's, that's solved the segregation issue, but there are definitely places that are trying to do some work. So and we work really closely with the Mobility Works team that is headed up by the Poverty Race Research Action Council that is helping housing authorities understand how to implement mobility programs. So programs where the housing authority is paying maybe a third party to help provide the services for families that do landlord outreach and have looked at how to implement small area FMRs and things like that to help people afford housing and make in places that are more expensive. But then, and so that's one way, is to help integrate other communities. The other thing that people are doing is with public housing, they're using the rental assistance demonstration program to be able to renovate their public housing properties so that they're better place, they're livable, they're better places to live, and they're keeping those properties in the community. We've seen evidence, and the Urban Institute has been looking at this, of how those RAD developments, once everything is finished, can be a catalyst for community investment. What we've got to do a better job of, though, is keeping people, when communities are changing and getting better, helping the families that live there stay. And that's where we need some innovation. And I would imagine there are folks on the phone actually that might be able to put in the chat things that you've done locally to look at that, whether it's looking at property, controlling property taxes locally, or home, or other incentives to help families keep their homes, home renovation projects, so helping families renovate their housing rather than having to move, things like that can really help families stay in the community. But we need to do a lot more with that. I was at a dinner, again, I think maybe that might have been the last public dinner thing that I had gone to. And there were, it was an international, there were people from all over the world there. And there was a woman there that I think was from somewhere in India, and had asked me, she's like, I've been asking people this question and they can never answer it. What does gentrification mean? And she's like, that it doesn't seem clear to me. I was like, well, it's just a word we use for when, white people move into places that would have traditionally been people of color. And so we came up with this word so that we didn't have to say it that way. And she was like, oh, okay, this makes sense. Why doesn't anybody ever say that? And I think that's the thing, is we've come up with all these words to describe the dynamics that we're trying to change in communities. And we need to just speak more clearly and more directly to what's happening in places, and because we need to capture who lives where, who are we making move, what's happening in communities, because race is such an overlay of all of it.
Definitely. All right, going once, going twice. Any last questions for Peggy? All right, well, like I said, you can also find her on Twitter at Peggy Bailey DC if you think of anything later. And we will be sharing this presentation and the slides afterwards with everyone who's registered and attended. So thank you again so much for being with us. That was a great conversation, very timely and very necessary, I think, as well.
Great. No, well, thank you. Thank everyone, and have a great rest of your day.
Yeah, thank you. And so if you've enjoyed today's talk, let us know by tweeting at us at NACCED News, NACCED News. And thank you just to everyone for being with us for this whole week of meetings. A special thank you to all of our speakers, Peggy, of course, and Alan Malik on Tuesday, and Diane until yesterday. And so if you are interested in knowing more about NACCED, send us an email to info@nacced.org. And I will also be staying in touch with you via email if you're registered for this, to let you know about future NACCED education opportunities, including our online conference that will be later this year in October. So more to come on that. And so once again, thank you everybody, and take care, and keep up the good work, everybody, on housing and addressing all these issues. So thanks again.